So cardiothoracic surgery in general is really fascinating to me because it changes people's lives immediately. So our research, when we write a paper, that can have a real impact in a matter of just months, maybe a year or two. So one of the very first projects I did inside of cardiothoracic surgery was with, he was a PhD student at this time. It was Andrew Goldstone. He's a PhD student in epidemiology. And he had really interesting questions about valve replacement and also some questions about acute type A dissections, which are these very scary ruptures of the aorta. And he and Peter Chu and a team of us really dug into the data and thought very carefully about these questions. And these papers are now being used to change how surgeries are done here in the United States. So we've modified people have modified the guidelines based on this. And that's just amazing. It feels really like useful, like being part of a team that's thinking very carefully and able to improve care. That seems really worth it. And I want to say that working as an academic for me, working on a team is really important. So one of the reasons I really like being in close collaboration with the folks in the cardiothoracic surgery department is like people like Andrew Goldstone are very thoughtful about what they're doing. And then they can craft these amazing questions and craft these amazing stories. And then we can analytically really go after them. We can have detailed theory about that. And that's just been wonderful as a statistician, as someone who thinks about data, thinks about combining, to partner up with someone who's like creative at that level has been just really rewarding. And being there in CT surgery and cardiothoracic surgery, I've also had the chance to meet two other people. So Elon Burton, who's a young surgeon and has started to really think about really complex questions of how care is being delivered. So some of that's very practical. How are we moving patients through surgery? The time it takes to move them from place to place. It's not a typical question that gets thought a lot about in surgery and sort of the literature of surgery. But she has a really interesting background. And so asking creative questions, knowing where to look for ways that we can improve care. And Elon and I have started a project that I think is extremely important, which is also thinking about how care is allocated. So, there are real disparities. So across genders, across race, ethnicities, and it's not clear that we're delivering the kind of care that we could. And so Elon and I have been really thinking carefully about how might we measure that? How might we think about if there is a problem? We suspect there might be a problem, but who knows? So we've been building out those kinds of questions, which I think is just really phenomenal. It's not always the way. These kinds of questions don't always come up in a med school. These are really questions that are built around people, improving care, and thinking carefully about that. And I really like those questions. And then one of my students, currently, Yan Min, who's a phenomenal statistician, a phenomenal epidemiologist, is thinking about really huge data sets. So we're talking 5 million patients. And she's thinking about what it would take to do extremely careful analyses, try to parse out, how much of the care improvement comes from a surgeon versus a hospital versus the patient's own underlying conditions. And so there's the complexity of dealing with gargantuan data sets, but then, also making sure that our arguments are not overly complicated, that our analyses are something that someone who's scared of data or scared of like fancy statistics, they could engage our question, that they should be able to push back on our analyses. So Jan is doing very complicated things, but making very simple arguments out of them. And this is the kind of stuff, this is the reason that I became a statistician, the reason I became an epidemiologist, to make really good, careful, well thought out arguments that can be critiqued by a lot of people. And so it's been really phenomenal. And all of this comes under Dr. Wu, who's the chair of cardiothoracic surgery. He's been building up a pretty amazing analytics team. And so it's just been phenomenal to be able to work with teams like that.